containing some heavy things, and also the so-called polydol pump, that is that is the paddy fields, they used to put insecticides, some agric chemicals. Polydol tama, that was the famous thing. But we didn't know what it was. Then gradually people were talking about something is going to happen, every houses will be sprayed with some tel, mahitel. That was then we later realized that something called DDT is the one that is there in those cylinders, cardboard cylinders, and the operation starts from that house. Entire houses in the village were sprayed with insecticide called DDT. And we had this curiosity, why this is being sprayed, and I was living not with my parents, I was living with my grandfather and family. So I asked my grandfather why this is. He told about a disease called malaria, and he was narrating the real malaria epidemic in Sri Lanka. Later I realized that he's talking about this 1935 malaria epidemic, but he was telling how much of devastation that happens during that epidemic. He told that in our family, that means my grandfather's, out of the children, one child was lost as in infancy, and that was due to malaria. And then he was talking about මං සිංහලෙන් කියන්නම් ආවල් ගෙදර ආවලාගේ පවුල මැරුණේ මැලේරියාවෙන් ආවලාගේ ආවලා මැරුණේ මැලේරියාවෙන්. He was talking so much of it in that village. He was talking so many people died of malaria, and we were not, I mean, later only we realized the gravity of this problem. And he was, one day he told that there was one family where there was no one to, there were 2 deaths in the family and no one to bury it, and villagers had to come and do it because all others were, I mean, incapacitated with the. So that was in Mavanella in Kagala district. The similar thing happened, and the story told me by another lady from Kagala, but on the other side of the Kagala, her family member was also died of malaria. That is my mother-in-law. She's from Kitulgala. But the entire Kagala district was devastated with this one. And after my graduation, I happened to be earlier with Susi and Santusha's place at Javardhanapura, but I decided to go to Kurunegala for different reasons, and from there did my internship and went to Polgavela, and then started working there. And entire Kurunegala district was even at that time devastated with malaria. And the cases of malaria numbered in hundreds of thousands. And in 1987, that was a little earlier than when we started, the maximum case reported was a number of, at that time was about 780,000 cases per year. And everywhere, and these cases were reported, and when I was doing my internship during the medical ward, almost every day there was at least 1 or 2 cases of this hematuria due to, GCSP deficiency, and then primaquine treatment, and then what really happened. And we had to treat similar cases in that area during that period. So we never thought that while we were serving as medical officers of health in that period, as that we will never be able to see the elimination of malaria. But for some reason or the other, I personally feel that people may not agree, but the one insecticide called lambda cyhalothrin was the key thing, because during our time when we were starting this control program, cases went down drastically when the new insecticide was introduced. But however, that was a to cut short the story, there was a drastic reduction of the cases, and then the wiping out or mopping up programs started, and finally I happened to be the director of the anti-malaria campaign in 2016, where I was posted, and there were stories saying that somebody outside was posted into the malaria campaign as directors when the so-called experts were there, but I can vouch that I had the opportunity to work in the grassroots level by going to houses and see how these things were done. And luckily, I was there in the Polgahavel Emocha, where the filaria control activities were also happening, and I can say that the hard work done by the public health people at that time was the key thing to eliminate these things using the newly introduced insecticides and other things. So with that one, we saw in between 2015 and 2019, several diseases were eliminated, and first the lymphatic filaria, and then malaria, and then the mother-to-child transmission of HIV, and all these things, and also measles. And we know that Global Fund was supported in a great way to eliminate most of these diseases, and because of the time constraints, I will ask permits from Santosh not to talk about disasters, and I would like to thank once again, and to stop at this point. Thank you.
Ladies and gentlemen, up next is Professor Upul Senarath to speak about something so important for many of us in this audience, about the evolution of the public health medical education in Sri Lanka. He walked in today and he asked, am I casual enough? Because the theme is casual. I said, you're so casual, you won half the battle. So he's going to speak for a short while about the evolution of public health system in Sri Lanka.
Good evening, my dear teachers, colleagues. So let me just go through the medical education, especially public health education, with certain milestones. In 1847 in Jaffna, there was a place to teach or train doctors at the medical school, but it is said that the dispensary of Dr. Samuel Green in Manipal, and there were graduates, so I think these just after graduation they are dressed in costumes. But that was not a formal medical education. Then the British rulers realized depopulation of Wani district due to infectious diseases, malaria and other infectious diseases. And then the governor, Sir Hercules Robinson, instructed Dr. James Lewis to study about it and make some recommendations. On his recommendation, it was decided to train doctors in the country. That was the formal establishment of the Colombo Medical School in 1870. So it was placed in the premises of NHSL. I think you all know this building. Initially it was there. Then at that time, since then, the public health was taught. And one of the popular teachers was Dr. Bandes Prathan. He has taught hygiene, public health, sanitation to medical students in this curriculum. So then, thereafter, I think with that, the National Hospital of Sri Lanka was established in 1872, which was used as the main teaching hospital of this medical faculty. And I think this was mentioned In 1926, that was a landmark in public health education, establishment of the first health unit, and at Kalutara. And also there was a very important thing, an association of medical officers of health, the Society of Medical Officers of Health, which later evolved as the College of Community Physicians. That was the oldest society of medical professionals, public health professionals, so we are proud of that. So that was in 1927. In 1949, there was another landmark in the history, the establishment of the Department of Community Medicine. It was named as the Department of Public Health and Preventive Medicine. This is not a picture of that. So this picture was taken fairly later. It was a landmark history in the public health, and the first professor of community medicine was Professor Abheratna. And recently we celebrated 75th anniversary of it, and I found this interesting picture of Professor Abheratna and another Sri Lankan doctor. It says, 4th International Congress on Malaria and Tropical Medicine, Washington, D.C., May 1948. So I was wondering how he traveled. He had a safe flight or a perilous voyage across Atlantic Ocean to Washington, D.C. That was an international conference in 1948. So he was the first professor of community medicine. And he was a dean as well. He held this position for 2 decades. That time, the public health was taught during the 3rd and 4th year. So taught course, there were tutorials, and also a field visit to a community to train about the public health, hygiene, etc. So then what happened? In 1968, Professor Earl de Fonseca took the chair or the head of the department, and he became, and he has 2 talents, as you said. He is an excellent public health teacher, as well as he is a conductor of the Colombo Symphony Orchestra. He's an excellent music player. He entertained the staff, but the successors couldn't do so. Either fortunately or unfortunately, successors couldn't entertain the staff through music, but they entertained the staff through other means. Right. There was another very important thing happened during that. The establishment of the field practice area, Kotti, was established during this time. There was a MOU with the Ministry of Health, and to officially designate the Kotti Medical Officer of Health area as the field practice area for community medicine, which is. In 1970, the faculty celebrated the 100th anniversary, and then Prime Minister Sirimao Bandaranaike inaugurated. And then 74, actually in 1974, the medical officer of Kotti, this is not the original, it was placed subsequently where it is now. The MOH Kotti, most of the Colombo graduates would have gone there, got the training, including myself. We had the training at Kotti Medical Officer of Health area was used for field training. 1976, the Postgraduate Institute of Medicine was established to train doctors postgraduate training locally. Until then, our experts or consultants were trained in European countries. They did the postgraduate, but 1976, the PGM started courses, and the community medicine was one of them. And 1962, Peradeniya Medical Faculty was established, and it was a landmark history and introduced the university life there. Right. So the university life, it is not only learning, but learning in a picturesque environment. You can see the amphitheater, Sarath Chandra Amphitheater there. So a lot of the learning with the environment, art, music, culture, everything in a campus. So 1978, the Jaffna Medical Faculty was started, and Professor Sivanyana Sundaram was the founder professor. In then 1980, private medical education a private medical school was established. You can see then President J.R. Jayawardena. And what happened? In 1981, if I am correct, Professor Lamabadu Sirisia, Ruhuna Medical Faculty, Karapiti, started teaching medicine. But 1988, 1999, there was a fight. Political analyst Rohan Gunaratna says a lost revolution. We have to agree, disagree. We don't know it's a loss, but it was a revolution. There was a lot of bloodshed, fight. Not only this was private medical school was one of the agenda of this revolution or this fight. According to Rohan Gunaratna, it's a lost revolution, but finally there was a victory. 1991, the Kalani Medical Faculty was established in the same grounds. And so a little bit of the curriculum, because then 1991 again, the Jayawardena Medical School of Medical Faculty was introduced to the system. A little bit of curriculum in this, it was a traditional curriculum where the students were taught in 2 years, right? Medicine, community medicine, with a field training in a field practice area. A little bit of research, inputs for research was also given. Statistics, epidemiology and demography was also part of that teaching. But in 1994, the college was established, and then Professor Durida Fernanda was the first president, and there were other colleagues. And the integrated curriculum introduced so many things, which curriculum was integrated, and throughout the MBBS curriculum, community medicine teaching was there. There were study guides, and then a lot of learning happens. And also, in 2006, there were 2 other medical faculties came into the system, and Colombo faculty took a bold decision to introduce the residential program, 10-day or 2 weeks residential program, which included a lot of edutain activities as well as inputs. And these are some of the experiences of students. And 2011, the Kothalavala Defence University started medicine. And 2018 and 19, Wayamba and Samaragamuwa. And finally 20, Moratua. So 2020, we celebrated 150th anniversary, and last year, Community Medicine Department celebrated our 75th anniversary. So I didn't want to touch much on curriculum, but just a milestone through the medical education in the country. Thank you very much.